My name is Elizabeth Como, and I'm a massage therapist at the Dempsey Center. And today I'm going to give you an introduction to the practice of acupressure. So acupressure is a component of acupuncture, which is based on traditional Chinese medicine. And traditional Chinese medicine has been practiced for many, many years. And in traditional Chinese medicine, practitioners often work along the meridians, channels that they have mapped through the body. And in traditional Chinese medicine, one of the things that they consider is that when the meridians are blocked or sluggish, our energy or qi, or ki, depending on which way you pronounce it, is not moving effectively through those channels. And this can manifest in a variety of different symptoms. So in traditional Chinese medicine, they think about those as imbalances. So one of the things that our practitioners who do acupuncture here at the Dempsey Center consider are the common side effects that cancer clients or patients do experience through their cancer journey. And so they practice what's called community acupuncture. And what I'm going to talk about are some really simple acupressure points that a person can access themselves, and some of the common symptoms or side effects that they might be experiencing. One of the things that happens when we access these acupressure points is that the thought process is that the energy is now free to move more effectively. In the Western medical perspective, the belief is that it stimulates the central nervous system and releases some of the chemicals which help us to achieve a more balanced picture of health. So in acupressure, we use a finger or a thumb. Some people will sometimes use a small ball, or I've heard folks use a clean avocado pit. Acupressure does not replace medical advice from your provider, and it would be important to talk to your provider about the possibility of using acupressure. There are some sort of general contraindications for acupressure. Those include open wounds on the area that you're touching, any swelling, inflammation, or bruising in the area that you're touching, blood clots or a history of blood clots, any tumor activity specifically in the area that you're touching, any recent chemotherapy, so that would be a conversation that you would have with your provider, any lymphedema in the area, scar tissue, varicose veins, pregnancy, and bone disease. So acupressure point considerations, you're going to apply gradual pressure for about 30 to 90 seconds. You need to breathe and allow the rhythm and speed and depth of your breathing to respond to the pressure that you're applying. Be gentle but firm, not so much pressure that you're creating excruciating pain. There might be a little bit of tenderness, might be sore or achy. And when in doubt, back off. I'm going to demonstrate a few very simple acupressure points that one can access on yourself. The first one is a common one that people may have heard of in the past. It's one that you don't want to access for certain if you're pregnant. It addresses headaches, pain, and digestive issues. And it's located on the muscle in the web of your finger and your thumb. And the nice thing about this one is that you can push with both your finger and your thumb on it and compress the point in the web. and you're holding it for between 30 to 90 seconds. That's the first one. That is point L4. The next one that I'm going to demonstrate is called Extra 1 or Yin Tang. This one is traditionally used to help manage stress or anxiety, and it's a very simple one to access. So between your eyebrows, you're going to press. I find pressing with my middle finger is nice, and you just press gently between your eyebrows. The next one that I'm going to demonstrate is called P6. And this one is another one that can also be used for nausea. So you take your arm and you're going to find the crease on your wrist, and you're going to go about 3 finger widths below and find that point and hold it. And this is another one that you can use either your finger or your thumb to press in. And I put my thumb on the back side because I'm facing you. It's a little bit easier than spinning my arm around. And you're just going to press gently between there. And then the last one that I'm going to access is called Ren 12. And this one is actually on your body. And there's the landmarks are kind of interesting. And so if you follow up the edges of your rib cage until you get to the center, and there's a little pointy spot called the xiphoid process in Western medicine. It's also called the dove's tail in traditional Chinese medicine. And then find your belly button, and you're going to go about halfway between those 2 points. And this is one that's definitely contraindicated in pregnancy. This one can help with gastrointestinal or digestive disturbances. It can help with pain, and it can also help with sleeplessness. And so you're going to press very gently on that spot and hold your point steady. And you may feel a little bit of a pulse when you do this one. So those are some very simple acupressure points. There's really good information that you can find through a variety of reliable sources, and you can find a variety of different acupuncture and acupressure practitioners who can give you reliable information about accessing these points. If you have the access to a massage therapist who knows acupressure or an acupuncturist who can help you find these points, they're often more than willing to help you learn how to access them and use them on yourself. Thank you so much for your time. I hope that I've given you some simple tools that you can use on your own. Don't hesitate to reach out to someone who has good information about acupressure if you feel uncomfortable about trying it on your own. And enjoy.